everyone. Good morning still, or where are we? Good afternoon, yeah. My name is Andrea Sonnes from University of Oslo as well. Katrina, I have a comment and a question for you. Thank you for your critique on the basically the high level work that's going on in relation to global health initiatives and all these kind of things. I would like to add sort of a local experience that I had that relates to that. What you were saying is that recently in Tanzania there was this a rubella vaccine campaign going on in one of the districts or the district where I work, and nurses were called to come to this training, 2-week training, highly funded, and obviously highly paid for these nurses. And we didn't really know that this was going on, but we got a call from our local facilitator who called us and said, listen, the facility is closed. We said, oh, why is the facility closed? And she said, yeah, nurses are gone. So we just asked her, so can you sit at this health facility for the rest of the sort of morning, see what happens? And what we realized is that all these nurses that had gone to this training for vaccination campaign that most likely saves billions of lives somehow, actually caused that day for 80 people to come to that health facility, of which 60 people that were women coming either pregnant or with a little baby on their arms, coming to that health facility that was closed. So coming, waiting for hours and going back. So in terms of maternal and child health care that we are talking about, it's interesting that maybe this vaccination campaign actually lost some lives along the way. This is just one day in one very rural dispensary. So my question for you was actually this district, with the district health officer that is called by this NGO to organize this campaign, this training for these healthcare workers. What can he possibly do? Because you know, he will do anything for this NGO to make sure that the campaign will be going on and that healthcare workers can go there to get their training, plus, you know, not to mention their fee that they will get for going to this training. And, you know, I think they deserve that too, somehow. But what can you, being a district medical officer, then do, you know, on that level? So I think that's my question.
Thank you very much for your comment and question. Well, the answer is that he can do very little. I would urge you to read the paper by our colleague Arima Mishra in the special issue which deals precisely with the conundrum that you raise. And I think perhaps the only thing that the district health officer can do is to report back on the effect that the vertical initiative is having on the ability of the health system to deliver integrated care. But I think that it is possible to enact change, and it has to happen both from the bottom up, but also from the top down. And I think it's important to start discussing these distortive effects more openly. There is now a growing body of research that documents the sort of effects that you observed on your one day in the clinic on a more systematic level. And I think it's important for global health leaders to own up to that body of research. One of the things, I don't remember if I put it in the paper now, but one of the things that my informants highlighted was the complete lack of engagement with that evidence within disease-specific initiatives, saying, actually, it's not that interesting, dismissing the research is not rigorous enough or not meaningful. So I think that there's a responsibility amongst the broader global health community to try to focus on those effects, and for the donors that fund the global health initiatives to think about the way in which they might be feeding into distorting the health system in that way.
Thank you very much. My name is Alik. I am an MPhil student at the University of Oslo. Thank you very much for all the presenters. My question, I think, to go to Catherine on the issue of health system. I was trying to imagine or to ask you if you can give your experience, because you talked on the issue of health systems more like the way we should take it in a political aspect rather than focusing on technicalities. As I know, most of the countries, the health system could differ, you know, politics differ. I wanted to ask you if you can give us an experience, personal experience in the countries that maybe you have been. How did you um, address this issue of to make sure that the health system is I mean, how did you yeah, I don't know. Yeah, how did you? Can you give an experience of the health system whereby you addressed the challenge? Because I'm trying to see the challenges behind also this aspect in both area, the technicalities and also in the politics. But I wanted to hear from you if you had done any. I mean, you have any experience based to politics area. I know there are many challenges behind this.
Thank you. I'm not sure if I understood the question entirely, but I guess you were trying to get at what sort of political processes need to be addressed rather than just technical challenges. And I think that the answer, if that's the question, depends on what level you're working at. So say if you're working at the global level, if we take the example that I've just been talking about, the health system strengthening support, it's about looking at the health system strengthening is not just about whether a vaccine gets down the cold chain to the person, but also looking at to what extent are the governments able to implement their own policy of what's about to happen, to what extent are priorities aligned between different donors, to what extent are issues of equity and social justice central to the way in which programs are planned and managed, and to what extent are the voices of the recipients of healthcare or the users of healthcare actually incorporated. I think those are sorts of political processes that are very rarely considered in the global debates. But of course, at the domestic level, I'm not quite sure if I understood the question, but there are lots of political processes that go into strengthening health systems that go beyond the technical, about incorporating user perspectives, about looking at what are the values underpinning this. Are we trying to just achieve mortality reduction, or are we trying to make sure that the most vulnerable populations are affected? Are we trying to just reduce mortality, or trying to make sure that people aren't catastrophically impoverished as a result of the health care that they pay for? And so I think maybe Fatou can talk about it more, but in Burkina Faso, for instance, our research has fed into debates about the financing of healthcare and the way in which it's not responsive to the needs of people. So I think you have to come at it from different angles and try to expand the analytical questions that we ask rather than look. I think somebody earlier today said we have to ask big questions rather than small questions, or in addition to small questions. So not just focus on the technicalities of how we deliver healthcare, but also why we're doing it. What are we trying to achieve on a societal level?
Hi. Hello. My name's Anne Danaya Asher. I'm a journalist based in Oslo with Development Today. Um, I'd like to ask a question about the expansion of health system strengthening in the GAVI portfolio. And you said that one of your informants, I think from WHO, had said that had seen this as a kind of a sinister move in a way to infringe on WHO's mandate in this area. And I wanted to know whether, I mean, do you agree with that? Is that a widely held belief in the sort of, excuse me, in the research community, or even, you know, among the UN agencies? And is there empirical evidence for that in terms of the massive funding for GAVI versus the situation for WHO and the other agencies normally working on HSS? Thanks.
Thank you. Well, you sort of answered the last part of your question yourself by pointing to the massive shift in funding that has taken place away from multilateral organizations towards global health initiatives. Um, it, it, the view that these sorts of initiatives are part of a wider attempt to usurp power, I think, is widely held, if not often explicitly articulated. Um, it's part of a historical shift in which, you know, you had the UN agencies being intergovernmental organizations responsible for the governance of global health, to a situation where intergovernmental organizations have become very relatively marginal compared to the public-private initiatives, of which they are part. Um, I don't think it's a controversial view. I mean, many people within the WHO articulated that view that Gavi is trying to take over. Gates is trying to take over. And I think that that's why I said at the start, these are debates that are often held in the hallway but aren't often written about. I think it's a very widely held perception that these entities have become more powerful. Of course, the money that they command is evidence of their power, but it's much more than that. And that's what I was trying to highlight, that it's not really about is it WHO or Gavi who's funding health system strengthening and who can do it better. It's about who has acquired the power to set the terms of the debate. And I think that there's a widespread perception that that is no longer the publicly mandated institutions, but rather the public-private initiatives that come with their own agenda. Does that answer your question? Yeah.
Thank you. I'm Johan Sabbe from University of Oslo. I've been working many years in Sierra Leone with health system strengthening, and I agree to everything you say. I've seen it myself. And my question goes to all of you. Now that we've seen the Ebola outbreak in this part, and the amount of money our government and also other governments are setting aside for this, how can we as researchers contribute to this involvement continuing after Ebola for general health system strengthening?
I think that was a great sort of question that we can go to all of you. And we just take the last sort of comment row. Yeah.
I was in the Gambia when the Ebola outbreak came, and the Gambia has a much better health system than Sierra Leone, much better. And I think such threats are indeed important for countries that face the situations, that they can sit together and take the issue up from their point of view and start the local debate that they need to do. That was done very much in that country in West Africa when I was around. I guess it's almost the first time I've seen it come up as a real threat that they took up at all levels. And I think the initiatives have to come from the countries, and then the response needs to come from the international. Now it's the other way around, totally. And I think we need to work on that shift, that the priorities are set much more in the local level, and that we respond by assisting more than imposing what we want to do. And we may have different goals even. But the threat of Ebola was real, and it was very heartfelt. And I have a Gambian colleague here. It was, wasn't it? Yeah.
No, that's fine. No, I don't want to say more because I've spoken plenty.
I think in Burkina Faso, where I conduct my researches, the most important thing I think at this moment is to try for researchers to try to give our voice about what we are doing with our research and to create the debate in local level. And this translate of our researchers is problematic when you work on a sensitive question like abortion.
Okay, thank you. Should we take one more? One more.
My name is Ibukwa Adepoju. I'm a master's student in Maastricht, and my master's thesis is going to be on health system strengthening in Rwanda. And one of the things I've noticed is that there is no clear definition of what health system strengthening is. Everybody has their own definition, and then they evaluate based on that definition. So I was wondering if you could comment on what your definition, or there's been a call for a general consensus, but it has not happened. So maybe we could start here, and I could put that in my research.
Unfortunately, I think we face the reality that not even institutions like the World Health Organization has done their homework properly. So I think there needs to be a renewal of the debate of what is the core elements of a health system, and how do the different elements interact, and what are the political processes that we need. We in Norway tend to think that we know, because we have a fairly good health system in the country where all these aspects are part of it. But also the health systems are under change. They change all the time. And the tension between public, private, between quality and coverage, all those things are in there. And we can't live with just one definition. We have to have a definition that can be changed along with what happens. That's my answer to that.
Thank you. I think that is a fantastic way of closing, because I think what we have heard from all the presenters is that health systems is more than healthcare delivery. I mean, you have all sort of presented a health system as, in a way, core social institutions that both on global and national level actually changes the way we think. And I think this is one of the most important lessons from this and from these fantastic distributions, and from the conference as well, that we should not forget that health system is core social institutions. Core social institutions, far more than technical delivery. And with that, we close and say, hooray, we go for health systems. Okay, thank you.